The annual International Women's Day is celebrated globally on March 8th to honor the achievements of women and raise awareness about gender equality. In Nigeria, the day holds special significance as it provides an opportunity to reflect on the progress made by Nigerian women, acknowledge the challenges they still face, and highlight their impact in various sectors. Despite the progress Nigerian women have made, significant challenges remain, including gender-based violence, low political representation, access to education and poor economic empowerment, among others. Women's health in Nigeria is of particular critical issue, with high maternal mortality due to poor healthcare access, inadequate skilled birth attendants, and lack of health education. Experts believe that prioritizing women's health through better access to care, education, and community-based programs is essential for Nigeria's socio-economic growth and future prosperity. Joining us now to discuss the urgent need to prioritize women's health in Nigeria and other issues affecting women is CEO, MD, Nigeria Solidarity Support Fund, Dr. Fejiro Chinye. Nwoko, it's good to have you with us.
Thank you. It's good to be here as well.
All right, so let's take a look at the need to prioritize women's health in Nigeria. If you could do an assessment in the past few years, where is Nigeria in terms of women's inclusion regarding their health?
Okay, so there have been a lot of progress, no doubt. We have made progress from maybe 10 years, 20 years. Maternal mortality is still high despite the progress, but we've made some progress in terms of including women to participate in their health, not just attending to them, in terms of increasing their social wellness, because the welfare has everything to do with health, in terms of even education for the girl child, which has everything to do with our health, nutrition. There's been improvement, but the outcomes, which are what will determine whether how well we have done as a nation compared to other nations, is still very high. Our national statistics is 512 deaths, maternal deaths per 100,000 live births, and globally, I think we're the second to the last. So it means that there is still a lot of work to do with women's health, involving them and also advocating for them in terms of access to health, in terms of health education, and in terms of those community-based intervention. And that's why, as NSSF, we said that we wanted to tackle female health.
It's really a very sad situation because we're not there yet. You've talked about the fact that we have 512 deaths per 100,000 live births. That is not something to be happy about. And what better day to talk about this than today's International Women's Day? In fact, March is dedicated to women, so give it up to women. And happy International Women's Day to you. But let's look at these issues. For instance, when you talk about factors that are leading to this issue of high maternal mortality in Nigeria, what would you say are the highest contributory factors? Some people will tell you there are cultural impediments, there are financial issues when it comes to accessibility to some of this healthcare for women. Let's talk about those issues.
Okay, so there are many issues, like we know, and there's multifactorial reasons why something happened. But I would like to highlight for today access to health. I think that more importantly, once there is access, we reduce the number of people, women, that do not receive care. When I mean access to health, we don't just mean hospital delivery. Even as simple as reproductive health, has access to sanitary towels. That is access to good health, right? Access to nutritional education for the girl child, replenishing her iron every month after her menstrual cycle. That is access to health, right? Making sure that those nutritional items are provided at a low or no cost to the female child. Then we talk about antenatal care. Then we talk about postnatal care. Then we talk about menopausal care. Access to care, I think, is one of our biggest problems. And we can look at why it is our biggest problem. Of course, there is the healthcare worker drainage that reduces the number of healthcare workers that we have to a patient. Right now, I think it's 1 to 5,000. One nurse or one health practitioner to 5,000 Nigerians. That is way low. Then we think about the healthcare facilities. How many of them are really functional? The primary healthcare facilities, how many are functional in Nigeria? The last check was about 20% of them are fully functional. And then we look at things like affordability. What is the cost compared to the minimum wage? and how affordable is this for, especially for the female that are disadvantaged in terms of economic power. So when we look at this, access to care is our greatest problem. We can deal with demand generation, which is usually cultural barriers and religious barriers. Those are easier to deal with, but this access is more capital intensive and it takes a lot of time, systemic building to get there. So it's really important that if there's an action we want to accelerate today, is that we want to increase the access to care. One way to easily do that is health insurance. Paying out of pocket is what discourages most people from going to the hospital or for accessing care in any way, because you don't know how much at the end of the day. You may go there thinking you just have a slight headache, and the next thing they're asking you to do an MRI, and you can't afford that, right? An MRI now should be about 100,000, if not more. And so that is very important, that every woman should have at least the state health insurance scheme, should be covered under at least the state health insurance scheme. It doesn't have to be private, or the national health insurance scheme. And if they are under the very vulnerable, meaning that their earning power is way less than the minimum wage, or they don't even have any form of earning power, there is provision in the national health insurance scheme for vulnerable people where they are given health insurance without pay until their economic power improves. So that is what our fight is, that why can't we get these very vulnerable women on this health insurance scheme? And health insurance is such a way, is pooling funds and in such a way that the rich can pay for the poor. And so why can't we absorb all of those people? So once we can do that, I know that eventually women will begin to access care more readily when they know that, okay, I went there and it worked for me. They didn't turn me back. They didn't ask me to bring, an arm and a foot. I was able to receive care. I got better care. Then they will go there. In NSSF, we have this youth empowerment program. And the idea was because we have a young population, right? Over 70% of our population are young Nigerians. And what we decided to do was to engage these creative youths to go and engage women and improve their health indices in terms of health education, in terms of increasing access to health, fighting for women's rights to increase access to health in the state. And we've seen a tremendous impact of that in Nigeria. So we're saying that everybody can be part of the solution. We don't have to always discuss all the failures. How can we be part of this solution? And we have this, our youth movement has made us realize that there are so many things with regards to female health that are not being discussed. Things like mental health for the females, postpartum depression. There are things that people don't even know the definition, not to talk of what causes it, not to talk of what are the treatments. And these youths engaging themselves, engaging their community, engaging their friends in a way that it's open and non-judgmental, is training up a lot of issues that are easily solvable. So that's really something we can take action on.
Let me come here. You've been talking about the issue of accessibility, which is key to all of our discussion today. Where does advocacy and enlightenment, what are the main ingredients? What role will they play in women's knowing about their rights regarding healthcare, accessibility to healthcare?
Absolutely. So one, it's why we are here today, right? We are trained light to this. We are raising awareness to this. Many people don't know that there is that provision, for example, like what I said, for the health insurance scheme for vulnerable women. So this, our youth engagement, is to engage other women in rural community, even in the urban community that do not have access to care, to say that, do you know that there is this provision? You can go to the state and get this provision to be registered under this. And so that bridges the lack of awareness. Nigerians don't know that there are things that you can get for either free or for little or nothing. So that engagement at the community level, at the grassroots level, going to them to say this is available. You don't need to go to a neighbor to go and deliver. You have this opportunity. You can go and deliver under this scheme without paying any money or just bringing X amount of money. That is where advocacy is very important, and that's why we had this We Nigeria Impact cohort, where we are training 35 young Nigerians right now in a 4-month program on female health, female rights to their health, how to increase access to health for females, especially for vulnerable females in terms of economic vulnerability. And then they have real intervention in the communities. That's what we're doing.
So what are the criteria you're using to select these women? How do you know who or where the vulnerable women are?
Okay, so how we pick vulnerability is based on engagement. You can't know if someone is vulnerable except you engage. So we go into the communities, the different communities in the local government area. We go in there, we introduce the subjects of female health, female rights to health, access to health, and from the conversations, we have something we call focus group discussion. It's something we use in public health to identify challenges, and you begin to understand that some of the challenges could be barriers to access to health. And when we ask that, then we find out what are the barriers, so the financial barriers or just knowledge barriers, and then we address that. For things like financial barriers are the things that we then highlight, and we work closely with the PAC to say, okay, these are the people that cannot afford care. And then there is a register that you can register for vulnerable people and you get access to care.
All right, briefly before we let you go, what are the challenges your group has faced, in the functions you've highly, enumerated recently?
It's entry barrier.
Okay.
So the trust level between Nigerians, either for policymakers, for government, or for ourselves is quite low. Entry barriers. People always feel that there's something up for you. Like, why are you interested in my welfare? Why are you interested? Are you really genuinely interested, or are you trying to just, make... Yes, there's a lot of trust deficits. So entering into the community and gaining their trust, for people to open up to what their challenges are, and for us to educate them, has been one of the greatest barriers. But when we are able to break that over time, when you continue, you persist, there is that trust over time. We find out that the impact is huge.
Well, we must appreciate you for your time on the show this afternoon. Dr. Fejiro Chinye Nwoko, CEO, MD Nigeria Solidarity Support Fund, and we wish you all the best in all your endeavors to promote the health of women in Nigeria.